Yeah, well, obviously, as we're getting into peak summer, it's a great time to think about our UV exposure. And, while I do think there's better awareness about the need for UV protection, particularly in our younger populations, we're still underutilizing the best UV strategies. And, I think oftentimes when patients are coming to me concerned about their history of UVB exposure, a lot of the damage has already been done. So making sure that younger populations are aware of the importance of UV exposure, um, uh, even in childhood is critical. And this is a great month to bring awareness to that. So, when we think about skin aging in general, the vast majority of skin aging is all from UV. And so, when we think about the two categories, photo aging and skin cancer and precancerous change, there is a lot of overlap. So, in terms of the type of findings that we're looking for in terms of precancerous change, these are going to be precursor lesions on the skin. So the most common thing would be what's called actinic keratosis. So actinic keratosis are lesions that feel pink and gritty, almost like sandpapery texture. Um, the actinic keratosis is a precursor lesion of squamous cell carcinoma. Each one of these lesions is not destined to go on to be a skin cancer, somewhere between 1 in 100 and 1 in 1,000 risk. But when patients have multiple, more than 10, or what we call field damage, where there are broad areas of involvement, their increase of skin cancer increases significantly. So there are other signs of photoaging that are also important. So when I'm evaluating a patient, whether it's in my skin cancer clinic or in my aesthetic clinic, the other signs of photoaging, such as dyspigmentation, lentigines, brown spots that are collecting on the skin, solar elastosis. So I often describe that to patients as that cobblestoning texture that you can see in the skin as the collagen kind of becomes more, instead of fibrillar and woven, sort of balled up and bumpy. Volume changes, loss of elasticity. While these are not precursor lesions themselves, this type of photoaging typically associated with history of UVA exposure versus UVB exposure for the more precancerous side. These are both carcinogens. And so the more photodamage you have of any type is telling me that about your risk profile. I'm a big believer in preventative therapies. And I think we are having a lot more understanding of things that we can do for prevention. And so starting first on the cancer side. So when we talk about field therapy, this is the concept of treating broad areas of skin for precancerous change. We know that if you took a biopsy of someone's skin and looked at the mutations, it's like a quilt of precancerous mutations lurking there. And as we get older, our immune senescence or our body's immune system's ability to kind of knock down these precancerous mutations or treat early skin cancers decreases. Our body's ability to for DNA repair mechanisms is lower. We get fibroblast senescence as well. And so in order to correct damage as these pathways are becoming less efficient, we have to sort of trick the body in certain ways. And so, there are kind of two arms of, what we can refer to as field therapy. So our traditional field therapies, we're using chemotherapy creams to treat precancerous change like Effudex. And now we have newer modality or newer protocols where we can combine with calcipotriene to decrease duration of treatment. These are kind of more direct field therapy approaches. Also under this umbrella would be photodynamic therapy, where again, we can treat broad areas of precancerous change, kind of seeking out the damaged skin cells, leaving the more normal skin cells alone. What I do think is interesting is this emerging field in terms of looking at the skin more completely. So we already mentioned the immune system, but what's the role that the dermis plays? And we have more evidence that resurfacing lasers, which are not just getting epidermal cells to turn over, but also modulating the dermis and creating a more healthy dermal milieu, are likely preventative for non-melanoma skin cancer as well. And so understanding that, I think, is where there's some interesting science going. You know, is this the interplay between the immune system and the dermis and the epidermis, or is the ground substance of the dermis important? Collagen, blood vessels, right? So there's a lot of components where I think we're going to learn a lot, that it's not just the mutations that live in the epidermis, it's the whole ecosystem.